And I just wanted to reiterate what Trish said about the value of your voices, and particularly of consumer voices. It is essential to help us make decisions, to help us know if the directions that we're going in are the right directions. And I just encourage you to be as involved and active and vocal as you possibly can. And you know, I've worked in a lot of different parts of health and public health, and you know, it's actually quite refreshing to be among people who really understand the complementary nature of things like clinics and services and medical services with things like employment and housing, and how health and mental health cannot really be achieved without thinking broadly about the needs, the global needs of people. And so you don't have to, I don't have to sort of, I used to have to make that argument dealing in other parts of the health department. Don't have to make that argument here. But the challenge here then is, how do we make it happen? How do we get more housing? How do we get more employment? And I could just say that the priorities that you articulate, as Larry said, you know, match exactly the priorities that we have in the department. And then last, I just wanted to say that another big theme of the work that we do at the Department of Health and Mental Hygiene, because as you know, we are in a unique situation of having the mental health, MRDD and alcohol and drug work be integrated into the larger health department in our city. It's not like that in most other jurisdictions. One of the things we care about most in our department is the elimination of health disparities, of the inequalities in health status between different populations. And there is no more stark disparity in health that we see in our city than in the life expectancy differences between the general, you know, New York City population overall and people with serious mental illness. I mean, it's rare that an epidemiologic study comes out, you know, a hard number study comes out and has such an iconic, such a powerful impact on a field. But when that epidemiologic study came out that revealed that people with serious mental illness die 20, 25, 30 years earlier than others in the general population, that's just unacceptable. There's nothing about mental illness that should reduce your life expectancy. And of course, the other interesting thing that study said is that the causes of death in the population are no different than the causes of death in the general population. Tobacco, overweight, obesity, diabetes. These are the things the department cares about, and it's those messages and those initiatives and those themes that we need to bring to the mental health community. It's something that you're already activated about. I know that people know these studies well, they know the data well, and the question is, how do we get in? How do we tailor our interventions and our strategies so that this unacceptable disparity is eliminated? So again, I want to highlight how aligned we are with your priorities, and how willing we are to work with you, and how we continue to want to hear your voices. And really, thanks again for having us today.